Imagine having an injury, but not needing to go under the knife or rely on addictive pain medication, yet you can be healed by shock waves. That's the idea behind something called soft wave therapy.
These are happy tears. Holy cow. When I got off the table, I didn't feel the pain for the first time, I guess maybe in 12 years.
This is really a nice little breakthrough for me. It really, truly is. It just brought back life to me that I had been without for so many years.
How was your experience using this device?
My experience has been life-changing. This has been a really amazing thing.
So it's nicknamed the stem cell machine. The idea is that it uses shock waves to recruit the body's own stem cells to help heal injuries.
All right, welcome everybody. We got today we got Dr. Matthew Doduro here. He's the Chief Medical Officer at Softwave TRT. You guys probably know me. I'm Zach Herman. I run Automated Practice and Go Chiro Marketing. We help practice owners grow their practice, but this is about the Ortho Gold 350 today. Many of you may know about the Ortho Gold 100, but I will let Dr. Doduro kick it off.
Thank you so much, Zach. I mean, the last 14, 15 years, we've had this OrthoGold 100 that has been such a versatile device. And as you know, is used in trauma centers and professional sporting teams in over 600 clinics across North America, but also at Harvard, Cleveland Clinic, Mayo Clinic, and just some of the top research universities in North America. So yeah, today I really want to get right into it and let people understand that this new model is the first upgrade we've seen in almost 15 years. I like to say this is a version 4 of the lithotripsy. So if it's okay, I'm going to share my screen. I wrote an article about 3.5 years ago now, calling this the greatest medical device in the last 30 years, in my lifetime at least. And, this isn't just a box that we sell to you. This is really a productivity and profitability increasing program. It's so easy to implement. I'm going to show you how, so many doctors, how we've been able to scale this over the last 3.5 years to multiple doctors. Does it really work? The OrthoGold 100 and now the 350 are both FDA 510 registered, but also Class 2 cleared for treatment of diabetic foot ulcers, as well as activation of connective tissue. That's important to understand, Zach, because that is the building matrix of all biological tissue in life. This is the fabric that holds everything together. It's our skin, it's our nerves, it's our muscle, it's our tendons. And I'm going to show you how this device, there's nothing else like it on the planet. We're also registered Class 1 to help decrease pain, improve circulation. And it's also now reimbursed by Medicare as of January 1st, 2022. So for a year, multidisciplinary clinics are able to bill for wounds, pressure ulcers, and burns. So does it really work? Yes. With musculoskeletal and general pain type issues, we're seeing 65 to 91% success rate. And this is in a clinical application. And this is with other doctors' failures. Patients have been going to doctor after doctor. We also have 133 peer-reviewed papers that we can talk to you about. The ones I like, there's 24 of them that show we activate stem cells, which are your repairmen of the body, within 45 minutes. So 12 of those are animal, 12 are human. And big kudos and credit to go to Dr. Tom Liu's research team out of University of California, San Francisco. So, oftentimes people are like, how much is it? And I'm like, no, what you should be saying is how many more people are you going to be able to help? Really? Right, that's it. And we like to focus on the ROII, as my friend Tony Ebel taught me. It's return on impact in your community first, and then ROI, return on investment, next. And people kind of get those things screwed up, but I think it's important to know that you're going to be helping so many more people that you were referring out. This is our list of, wonderful organizations that we work with. Why haven't you heard of it? Well, simply put, it's somewhat new technology. You know, at least it's a new spin on a technology that's been around for 40 years. I made a little typo there. There's actually 600 plus clinics now in the US with this device. It's being used by some of the top clinics and professional sporting teams, both on the Live Tour now, and 3 teams in the NBA, 3 teams in NFL, and I'm sorry, 5 NBA teams and 3 Major League Baseball teams. We were also featured on the Doctors. You know, Dr. James Bradley, who's been the team physician for 31 years for the orthopedic or for the Pittsburgh Steelers. He has one in his private practice. And so he's been, you know, instrumental in getting us into University of Pittsburgh Medical Center in their orthopedic group, but as well as they have one for the team. And he calls this his secret weapon for getting his players back on the field faster and quicker. That's right up here is Jim Maurer. He's been the head trainer for the Dallas Cowboys for 35 years. He's had one of our devices. His training staff has had one for over 2 years now. We're really happy. They lost last night, but the World Series champions, Atlanta Braves, they're now had it for the last several months and enjoying it. And then one of our favorites is Graham McDowell, who's a professional golfer and US Open champion. So I think we've got a couple more. The Miami Dolphins have it as well. And then as you see right over here, that's Dr. John Boone. He's one of the few doctors of physical therapies and athletic trainers in the whole NFL. So he's really progressive, and we were psyched. Kind of what Dr. Martin O'Malley, who's the foot and ankle specialist for the NBA, he's like, basically, he's got 2 of our devices, and he came out and was so kind to give us a really great testimonial. But he said, if you're working with athletes or doing sports medicine in 2022 and beyond, then you need this technology in your clinic. And he says the OrthoGold machine is one of the most commonly employed biological treatment modalities and very well tolerated by patients. And he notices marked improvement clinical outcomes compared to anything else on the market. He calls SoftWave a proven modality for a variety of orthopedic conditions, and the OrthoGold machine produces a true medical shockwave that includes appropriate biological responses. So that's pretty nice. Like, there's a lot of shockwaves out there. You know, not all of them are created equal. You can't buy a $5,000, you know, car and compare it to a Bugatti or a Tesla. Okay. Wow, there's really nothing else like this on the planet. This is electro-hydraulically produced supersonic sound waves that are traveling over 3,355 miles an hour. This is the same technology they've used for 40 years in a hospital setting to break up kidney stones with an 85% success rate. There's little downtime. There's the FDA labels this as a non-significant risk factor because there's minimal side effects. And it's really been the standard of care for the last 12 years in the Austrian workers' comp system. And they have this in, I believe, 13 trauma centers. So if you fall off a ladder and you bang up your shoulder, you go in and they take x-rays. They don't do cortisone shots anymore. They think that's barbaric. They actually use our SoftWave technology, and within a handful of sessions, they get that person tuned up. Our company's been around for over 15 years. I'm standing in our boardroom. There's 48 patents from that our CEO, John Warlick, and our team has put together. We spent millions on protecting those patents. We've spent 25 million on research and development, and we've helped fund over 133 peer-reviewed studies. So there's no one else that's doing this work. There is the spinal cord injury study that I always reference, and that's a national health mandate that the Austrian government put together now 3.5 years ago. And basically any person that's in the borders of their country, if they have a spinal cord injury, They have our treatment done within 72 hours or 3 days. And this is important to understand because the research is now showing that we downregulate inflammation. So, 9% of injuries, it's like paralysis, spinal cord is severed or infringed on, and boom, they're either quad or paraplegic, depending on what level. But what they realize is 91% of paralysis are typically happening within 3 to 8 days. And so you don't want a hematoma developing close to the spinal cord that can put pressure or cut off blood supply. So it really, if you lose blood supply or oxygen-rich elements getting to that spinal cord, you can have permanent damage. Okay, this is my favorite slide in our presentation. It talks about the positive biological effects. And what you see on the left here is the mitochondrial. And many of you will remember that the mitochondrial are the powerhouse to the cell. They help generate enough energy for the body to utilize oxygen properly and turn that into what's called ATP. And the one on the left is more of an anaerobic state where it's not utilizing oxygen properly. And what you see on the right is just 10 minutes after our SoftWave device is utilized on a cellular basis. And now what you're seeing on the right is something that is much more efficient. And in the Krebs cycle, which a lot of the doctors will remember from biochemistry, it's producing more 32 ATP. So it's the most efficient way for the body to work. And that is a direct correlation to our device. The next one is an actual patient. You see that blue foot? It's terrible. It's cyanotic. And I say, when I see stuff like that, I say sayonara, because it's not going to be around for long. But this is basically after a 3-minute treatment that we utilized our SoftWave, and it helps create vasodilation by releasing what's called vascular endothelial factor. That's VEGF, and it helps with synthesis of nitric oxide and brings oxygen-rich blood to that area to create a really fertile environment. But again, this may be the most versatile device, and these are the benefits. Obviously, upper right, you'll see on the skeleton here, improved mitochondrial function, angiogenesis, and after 10 to 12 weeks, neovascularization, which is new blood pathways. We see improved ejection fraction rates in cardio tissue. I've done an interview that's on our SoftWave View, which is a wonderful private Facebook group where we have over 1,400 doctors and technicians from 24 different countries. So we're all there utilizing this technology. But Dr. Johannes Holfeld has successfully treated 67 bypass patients, and during open heart surgery is literally using our patented technology right on the heart for 3 minutes. 1 year later, there's a 10% improvement in that left ventricular ejection fraction. So it's stable and it's a one-time deal. So that's, there's never in our lifetime been anything that is considered cardiac regeneration. This is the first viable option. It's also used by many urologists for improving men's and women's sexual health. It helps reduce pain and improve range of motion with near immediate relief. And it accelerates healing and non-healing fractures in the lower extremity. It has an antibacterial and antimicrobial effect, so it's working with wounds. It improves extra vesicle circulation and messenger RNA and exosomes. So those are your helper cells and repair cells. And it's stimulation of your own stem cells within 45 minutes of treatment. There's that class 2 clearance, activation of connective tissue. But I think the thing that makes this a billion-dollar technology is that we help modulate inflammation. And to me, this is the main culprit where most of the pain is coming from, especially people with, stage 2 and stage 3 degeneration in their knees or hips. This thing, it doesn't reverse degeneration, but what it does is it downregulates or helps decrease that inflammatory process. And that's where the most of the pain is coming from. So that's why patients feel like, oh my God, like I can't believe it. One visit doesn't fix everything, but it starts the whole healing process. And the same cardiac surgeon, Johannes Hofeld, his team over the last 10 years is the ones that realized and really found that this is, our technology is activating a protein on our DNA called toll-like receptors 3 and 4 that helps modulate that inflammation. And to put that in the big picture, for the last 50 years, the holy grail for pharmacology is to develop a drug, a pill, or an injection that would lower inflammation. But what if it came from, taking this lithotripsy technology and putting it in a handheld applicator that we can point where the pain is and literally turn off that inflammatory process for minutes to hours, sometimes days, and even weeks. So we've kind of talked about this positive biological effect. It stimulates healing naturally, accelerates the body's natural healing ability, decreases pain. We see after 3 visits, a 50% reduction in the pain. Activate those dormant stem cells that are the repairmen of the body. Again, modulate inflammation as well as improve that circulation. What does it treat? Any area with inflammation, anything that has an itis, right? So plantar fasciitis, epicondylitis, anything, carpal tunnel. We work with a lot of skin pathologies. We sell this to dermatologists and plastic surgeons. Again, for non-healing fractures, it's been awesome. But really any type of Achilles tendinopathies, greater trochanter, all those type of things, it works well. With this also comes our advanced orthopedic virtual training series. And this is really a patent pending protocol that shows how we developed a 10-minute game plan to really find out within minutes if this patient is a candidate for this futuristic technology. And you should say, why? When you run this technology over normal tissue, there's no pain. As soon as you run it over areas where there's arthritis, poor circulation, inflammation, or even subluxation, especially like ribs, there's this biofeedback component where the patient will be like right there. So we can literally pinpoint where the true source of pain is coming from. If we scan a patient's chief complaint and we can't find any tenderness or hot spots, they're not candidates. It's as simple as that. So we've created a 90-day challenge that you'll learn about in a little bit, but this is really easy to implement. I mean, you can get our virtual training series. You can have the basic certification done within 32 minutes. And then we also show you how the business side of it. So it's again, very user-friendly. We now have over 650 healthcare providers across North America. This is an elite group of doctors. We're not looking to place this in everybody with a pulse. We're not Coca-Cola. We don't have to sell this to everybody with a parched throat. This is for a few doctors who really want to add their proficiency and take care of a lot tougher. After talking to over 3,000 doctors over the last 5.5, 6 years, I realized that there's certain things that keep doctors up at night. And, number one is, will my body be able to hold up to the vigors of this really difficult profession that we're in? So, but many doctors are staying up because, hey, will they have enough money to retire? Can they send their kids to college? For me, I have 3 daughters. Like, was I going to be able to pay for their weddings? And this has really been a technology that has placed me into a different league. And these are the things that we'll see, right? Elevating your practice, it increases revenue. We're seeing on average when you kind of pair this with a really good digital marketing, that you can generate 35 to 50 leads, depending on what you want to spend on ad spend. Still, after 127 years of chiropractic being in healthcare, we're only attracting 10 to 12% of the population will even consider going to a chiropractor. That means 88 to 90% of the people won't even consider going to you. But when you pair this technology with your clinic, now you have 100% of the people in your community that are looking to find relief. And again, they see the digital ads that your team are creating and a couple of our other digital partners, and they just want that. Really, it's going to elevate healthcare. It's going to take our broken healthcare system from bad to good. And, you know, it's easy for doctors to convert prospects to patients. And I believe it's going to help elevate our healthcare system to levels we haven't seen. And again, it's considered the first potent therapy for spinal cord injury patients. We're getting ready to launch an advanced certification on whiplash and acceleration deceleration, and how this is really going to make an impact, especially when we're in trauma centers. And our goal is to be in more trauma centers. These are just a dozen or so of our patients. I mean, our different doctors who have been utilizing this for 2 and 3 years. Dr. Kyle Bowers, who's one of our national trainers, over the last 2 years has generated over $1 million. Dr. Corey and did over 41,000 with the first month using the OrthoGold. Dr. Jeff did 38,000. He's also one of our national trainers in the first 6 weeks. Dr. Ashlyn and Kaylin have generated over $1 million in the last 3 years with just one device. Dr. Scott, who collects over 55 grand a month with 2 devices, has generated close to $2 million in 3 years. Dr. Sue Airy has done about 38,000 per month and generated 450,000 per year over the last 2.5 years. Dr. Todd, in the first 7 weeks, did 64,000. Dr. George is amazing, lower right corner. He sold $35,000 in pre-sales prior to even getting his device and collected $75,000 in the first 9 days of owning it. So that's pretty cool. The Dr. Mike holds, these two are our record holders. Dr. Mike on top collected $25,000 in the first day of using his OrthoGold 100. And Dr. Stacy and Nate, they are the king and queen. They did over 122,000 in the first 70 days. They owned it. And this is really the sine wave of all new technology that comes in. And right now, we are just at less than 1% of all chiropractors in the profession. And so we still have all of this for the innovators. These doctors that buy today or in the next few months are still going to be considered innovators. But very soon you'll get 13% of early adopters. They're still considered visionaries. When you add these two together, you're at that 16%, and you start jumping the chasm, right? So now you get the floodgates opening, and that's when the early majority who are still sitting on the sideline. Some of these docs that are watching this have been keeping an eye on us as this company has grown over the last few years. Now is the time to jump in. So basically, what do you get with the 350, which is a supercharged version? You get 2 brand new applicators that are about $4,000 each, and you get 1 refurbishment that normally would be $2,000. So it's about $10,000 value just in the probes. And these probes are different because the OrthoGold 100 had about 200 treatments per probe. These are going to have 700. So if you have 3 of those, that generates 2,100 treatments total before you ever go to refurbish a probe. Now, the beautiful thing is 700 treatments times, just say $100 is somewhat low, but it will work anywhere in the country. That means you're going to make $70,000 per applicator, and having 3 of those applicators generates $210,000 before you ever have to pay for refurbishment. And what we're doing for anybody that signs up or wants to move forward, instead of paying $2,000 per applicator, they're going to pay $1,750. We predict this will be a 3-to-1 return on investment for our doctors. This is an investment into your practice and the future health of your community. So this device right now, the 350, it is going to be list price at about $89,000. we're going to have a $10,000 rebate. So you'll be able to get in this for basically just under 80K. For under $1,300 a month, you can actually have this in your clinic. And that's basically one new patient, pays for itself. There's also a beautiful program that we're working with Wells Fargo. It's 0 money down and a 3-month deferred payment. And what we did is we created a 90-day challenge. And if you keep track of your monthly, gross revenue, if you're able to collect that 79, we'll give you $1,000 in SoftWave credits to put towards your first refurbishment. So this is, it's pretty easy getting started. It's as simple as filling out the leasing application that we'll have tied to this program. We know within basically 3 hours if you're a candidate for the 3-month deferred payment option. Once approved, we typically can get the new OrthoGold 350 within 10 to 14 days to your clinic. That gives us time to really get your basic certification, and we send that all virtually, and you start your training and your staff's training. The other thing is like 75% of all these treatments can be done by a certified technician. So we literally fly in one of our national trainers, and you line up 10 to 12 of the worst patients in your clinic, those ones who've been there so loyal to you, who come, on a regular basis for your adjustments, but still have underlying issues that haven't been able, conservative care hasn't been able to address. And we just line them up every 10 to 15 minutes. Boom, 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 boom. So we're there for like 3.5 hours, and then we're flying to another spot. Get ready to make an impact on your community and become one of the top shockwave docs on the planet.
Very good.
How come? Tell me what's different about your hands.
So I can move it, opening them all the way like.
How long has it been since you've been able to do that?
20 years.
20 years?
Yeah.
I think it's nice. I think it works better on the joint.
Ooh, what's up? All right, don't over push it there. Man needs a knee replacement.
Well, I don't. There's no tightness in my back.
It's pretty cool, isn't it?
That's crazy. I guess I don't realize how much bigger it is when I walk.
But it is remarkable, and even the doctors that are looking at it are like, this is unbelievable progress.
So transformation.